In 2020, the onset of COVID-19 saw rigorous efforts of general health data collection in Western Kenya, led by local community health initiatives under the direction of the Kenyan Ministry of Health. As a result, the UK-Kenya-based NGO, the NASIO Trust, observed a 90% decrease in waterborne disease figures in the same reporting period between 2019 and 2020. This was because the team was able to leverage this data to gain insight into where local health initiatives and response plans needed to be more active. While the value of health data collection is evident, its undertaking in a resource-constrained setting, as in rural sub-county Mumias, Kenya, is limited due to weak internet and technological infrastructure. Current methods of data collection on the ground are manual and labor-intensive. During regular household checkups, healthcare volunteers create handwritten records of patient responses on physical health questionnaires, which they then need to gather at the NASIO headquarters to manually enter each response into an Excel spreadsheet.
We have been collaborating with NASIO Trust medical team for 4 months to co-develop Collectous, the basic open-source Android app system that will automate this data collection process. During regular household checkups, verified healthcare volunteer will be able to directly input patient information into a structured database through a free-form, editable digital questionnaire. This can all be conducted in a fully offline mode where the app will temporarily store the health data locally before uploading them to the cloud-based storage system when stable internet of sufficient bandwidth is detected. To protect the privacy of sensitive health information, local copies of data will be automatically wiped once uploaded to minimize vulnerability and risk. This data is then collated into master file on the cloud system, which is accessible only to authorized personnel from the NGO headquarters. Analytics can be performed to monitor and evaluate the effectiveness of health initiatives aimed at increasing immunization coverage and reducing levels of waterborne disease, malaria and HIV/AIDS and teen pregnancy. Analytics will be run on the master file data once every month before findings are submitted to the sub-county representative of Kenya Ministry of Health.
Collectous has a direct impact on the third SDG for good health and well-being, with particular contribution to Target 3.3 by monitoring community progress in ending the epidemics of AIDS and malaria, as well as combating hepatitis, waterborne diseases, and other communicable diseases. Furthermore, the project partially contributes to Target 3.8 by tracking immunization coverage to ensure access to safe, effective, quality, and affordable vaccines. Our ultimate vision is to form a network of local NGOs to collect larger volumes of health data for more accurate insights across a wider geographical region. To realize this vision, we have focused on using our project to create greater accessibility to contextually appropriate data collection tools, particularly for community organizations that lack the financial capacity to afford other off-the-shelf alternatives.
Furthermore, we believe that Collectous will play a key role in laying the infrastructural foundations to democratize the advantages of AI-based technologies for emerging nations. AI tools require large volumes of quality structured data that is organized and stored in a consistent manner to be immediately amenable for use. Collectous would be an affordable and efficient means for community organizations to begin creating such structured databases and realize further opportunities to tap into the power of data-driven tools. Our team is committed to engaging with the challenges of implementation head-on and hand-in-hand with the local community of Mumias to develop a means of not only tracking community health, but a grander goal of closing the digital divide in the accessibility of data-driven technologies.